Are surgeries such as ear cropping, declawing, or debarking appropriate?
So I feel like that's not ever really appropriate to do because you're basically removing a bone. There's a lot of other alternatives that you can do. You can get scratching posts if that's the issue that you're having, them like destroying your furniture and everything. Or you can get little silicone or plastic caps that go over their nails.
But they hate the caps.
Then you can cut your cat's nails.
They hate the nail trims.
Well,
I can't cut his nails. This is what owners say.
We can always try bringing him in and just do a sedated nail trim and everything.
But that costs me money.
So does surgery. I'm kidding.
Yeah, but that's a permanent option though.
Yeah, but we can always try like medications at home like GABA. That's for like anxiety. So that could be like a cause of like cats tearing up your furniture and everything. They're not having like enough mental stimulation. They could be really anxious. So if you give them GABA, it's a medication that can help calm like their nerves and everything. It's generally really easy to give. So it could be another alternative.
But why can't I just declaw?
It's a really painful procedure. You're basically removing their knuckle.
Can you imagine taking that part of you and then just walking around, putting all your weight on that?
Yeah, putting all your weight on a part of your body that isn't supposed to.
It puts
bear weight.
Yeah, literally.
It can cause like a lot of problems like
arthritis.
Yeah.
I mean, we had a patient a couple months ago that was like 11 years old that was still having problems from his declaw when he was in the hospital for wound management from, like, he had abscesses on his paws from his declaw when he was a kitten.
I was gonna say, even just
That's
like
terrible.
post surgery, like it is such a gruesome like process because my old DVM did that, and like literally they had to have like super soft like litter. They had to like be like basically in a cage for like 14 days on pain medication for that whole period. Like,
and if there's ever any reason like that cat,
and you said risk of infection. Sorry.
Yeah, but also if there's any like ever any reason that the cat would end up as an outdoor cat.
Oh yeah.
Then
like what if it got out?
Yeah, they have no.
That is wild because I have seen indoor outdoor cats that are declawed. And then what do we feel like for the less popular, conversations, ear cropping and debarking? First of all, like what is debarking?
It's where they cut like your voice box. Basically for
the vocal cords.
Yeah, the vocal cords. Yeah. And they're no longer able to bark.
They can still make noise though.
Like that the movie from the movie Grown Ups.
Yeah, I had a
dog
patient that was to bark.
Really?
Yeah. And it still made a noise. It was not a great noise.
It's just not loud. It's loud, right?
Yeah, it was like a little dog.
Was it like a Frenchie?
No, it was like...
Because imagine that noise.
That'd be awful.
It would.
It's usually just complaints from like neighbors typically that leave them there, right? I would say.
Yeah.
Yeah. I don't know like if there are laws saying that like with a certain amount of noise complaints or something, like you have to do something like about your animals barking, like if you have to like rehome or euthanize. I don't know. I just feel like that would be wild.
I personally would never do that surgery.
I wouldn't.
No.
You would never perform it.
I would never perform that or a declaw or an ear cropping.
I feel like ear croppings aren't as bad, but I still like don't agree with them.
Right.
Just because
it's just cosmetic.
It is. And that's what's wrong about like, I want to say wrong, but like it just gives me ick about the whole thing.
What about tail docking?
Tail docking?
What'd you say?
I feel like that's ick too.
It's like the Doberman, like
I know it's like the breed standard, but like, my God.
I mean, one of my dogs has a dog tail.
Yeah.
My other dog was actually born without a tail. I think I probably would choose to keep the tail if I would have been able to choose.
Yeah. I mean, like, really
at least they do
preference.
it like early on, like when they're
and
newborn. So that's like
with tail docking, I'm kind of back and forth because there's a reason that it's breed standard. Yeah. Which is because they're working dogs. Like a border collie that is like actually doing what they do, like herding sheep. Like if their tail gets stepped on, like that hurts. Like that's bad and it can get degloved and everything.
That's fair. But what about like the ones that are just planning to
like mine
just be pretty at home?
My fat little Aussie.
Exactly.
Yeah. I don't know if you guys have ever noticed this, but I've noticed like a lot of Aussies that with dog tails like really hate their nose touched like more than other dogs.
Yeah. It's very sensitive, I feel like.
Yeah, and you have to wonder like is it because of like all those nerves from them just chopping their little tail off, and if they didn't grow back or like grow back right or like grow over right.
Scars are also just painful because like I have certain scars that like when I touch them like they end up hurting and everything. Yeah. So
and then they sit on it too.
Yeah.
As somebody that has dogs or a dog that got its tail docked, I think it's really cute. Like I will say, no, I do. I think it's
fair.
I think it's really cute. Like Cooper's little wiggle butt is the cutest thing ever, and I feel like he wouldn't be himself if he didn't have his little wiggle butt.
But you don't know that.
But I don't know that.
Yeah.
And they're still beautiful dogs with their tail. Like Aussies have beautiful tails, and you just don't see them very often. But it is more common now when you're like looking for like a reputable breeder for them to say like if you're, you know, like in line for a puppy, like do you want us to dock the tail or not? Because then you can say like, oh no, this is gonna be a house pet versus no, this dog is gonna be herding sheep. Like I really think you should have his tail docked.
I will say like if it's done appropriately, there's a time and a place for it. But if it's done like inappropriately, like a lot of breeders will do it at home. I had a case where it was like these Rottweiler puppies that they docked the tails at home, and it was with like a rusty pair of scissors and everything, and like they were so young, their eyes were closed, their ears were closed still, and they came in and they like were all septic and everything, and I couldn't get an NG tube in because like in animals that are that young, their cribriform plate hasn't hardened all the way, so you run the risk of piercing into the brain, so it's really dangerous to do that. So we weren't able to place an NG tube. We also just didn't have one for that size. We couldn't give them any pain meds because we don't have any like dosages for animals that weigh that size. Like there were only a couple grams and everything. And they ended up all dying because of like the infection that was caused by the owners of them docking their tails at home with a rusty pair of scissors. So I feel like there's definitely a good way to go about it and a bad way to go about it.
How do we feel about like breeders, like reputable breeders versus just, you know, I want to breed my puppy.
I want to give my dog the experience of motherhood.
Exactly. Or I want to give my male dog the pleasure of coitus.
Those are, or
your dog doesn't care.
He's gonna hump.
Your dog does not want to be a mom. Yeah. None of these dogs we see want to be mothers.
No. The one dog that came in. Some dogs are not meant to be mothers. Some dogs will see their. You know what I'm saying?
Is it the one where she ate his leg?
Yes.
Yeah.
Some
I
will
have a
come
picture
out,
of that.
Some will come out and they will try to kill them or eat them.
Yeah.
Yeah.
They say,
I firmly believe in breeders, reputable breeders.
Yes.
I believe that they are needed to preserve all of our breeds. My one dog was not from a reputable breeder, but my other dog was. I've never bought a dog from a shelter, so I'm definitely not against breeders, but I think you have to do your research. You want to know that they're health tested. You want to know that they come from a good line. But it is hard. It's hard to find a breeder that does all of those things. I think the thing that people run into when they're looking for a puppy is like, I want a puppy now.
Yeah.
I don't want to be on a wait list for a litter that's going to happen in 2 years. I think that if you want a puppy now, then you should go get a dog from a shelter or something.
Yeah, because like, what about the dogs? What? Let's see. What do you think about like the breeders that give their own vaccines too? At
you
home?
Can't trust that.
Yeah,
because you have no idea that they're stored correctly. You have no idea.
We say, okay, we're just gonna start the series over. We're just gonna restart it. Like it's a waste of everybody's money.
Yeah, it's a waste of time. It's a waste of money. We run into the same problem when people get vaccines from stores like Tractor Supply because again they have to be stored at like a certain temperature. They have to have all these things done to make sure that the vaccine stays like good, and a lot of the time that's not done. It's the same thing with like even like prevention.
I was just about to say,
like I know Costco sells flea and tick and heartworm prevention, and it's like these things do have like expiration dates. They have to be stored a certain way, or else they will go bad and they just like lose their efficacy and everything.
At least like the prescription ones I feel like are better, but I was just like thinking of like the brands that are like Hearts that make like flea tick prevention, that like the over the counter stuff.
Yeah.
And like the off brand Seresto collars.
Yes.
Those are extremely dangerous. And I was taught about in like one of my classes about like they do like counterfeit stuff.
What?
Yeah, there's like counterfeit stuff. So like she gave us an example of like Frontline Plus, 2 different ones. Mm-hmm. and then like how to look for counterfeit stuff because people will literally sell like stuff that doesn't have the correct ingredients in it.
I never even knew that.
So that's why
that's wild.
That is always why we recommend getting a prescription through a veterinarian.
Yeah.
So the next question I have for ethical scenarios is is it okay for animals to be hospitalized overnight without nurse supervision?
Go
ahead, Samantha. What do you think?
It depends on what level of hospitalization you're talking about.
Let's talk about ICU.
Yeah, no.
No, just let's think about like
if you're talking about
like something like our GPs that we used to work
Right.
for. We have like a sick patient that's not sick enough to like go to like critical care to the ICU, but just needs like fluids overnight, let's say.
I think that
Or to stay on fluids, rather.
Like what, like a pink dog or something?
Huh? Yeah.
Okay.
if that's like the most that you can do, then and the patient needs the fluids, then I don't think if that's all you can do, if you can't get them to a 24-hour care center, then
Yeah.
yeah. But I think it's also very patient dependent. Like, is this
Yeah, because it can
wild
be very
husky
dangerous.
that is going to eat the IV and
Yeah.
eat everything else? Or is it,
like a dull, quiet, like
yeah.
dog.
But then also if it's a sick enough patient where it's not going to react like that, then no, it shouldn't be. I know a lot of GPs will do like post-op patients will stay the night, like post-op spays and stuff. I don't really see a problem with that.
I was going to say, that's usually on nothing, though. That's just like strictly boarding.
Yeah. So I don't see a problem with that.
Yeah.
But I see once you get like IV fluids involved and stuff like that, where like things could get ingested overnight or
Like anything with a catheter.
something can go wrong.
But there's also like electrolytes in fluids and like say the pump malfunctions for
Right.
whatever reason and they get fluid overload.
Right.
Like worst case scenario, if like the fluids stop, then they stop, right?
Right.
But they could get overloaded.
But there's
they
a reason
could
that
get
we
like
have.
elevated sodium levels and cause further issues in
Right.
organs and everything. So
Or like even if like the bag runs out and then air. Like
yeah,
a lot of the pumps, they
I would hope
have,
that it would stop, but
yeah, they have like air detection, so they will stop. But like I don't know, like you were saying, like what if the pump malfunctions?
Exactly.
Like I haven't seen it, but like it's a possibility.
Yeah, we don't know.
I think that if it's
You
like
just have to run your risks.
yeah,
and benefits.
risk versus benefit in that scenario, like is this what this patient really truly needs is a night of fluids, and can we not get them to? Is this the best we can do?
Yeah.
Then it's just a risk versus benefit type of thing.
I mean, I feel like we kind of face similar issues in like the ICU with 24/7 care, just like when people are reaching like the top of their estimates and they're tapped out with money. And like this morning I had a cat that was febrile at 104 post urinary obstruction. We pulled the UCAF and we had to send him home. Like there's nothing we could do. There were sources of infection and everything. So like,
yeah,
we couldn't like draw anything for urinalysis. Like there's just,
Yeah.
you're just tapped out.
I like to think best patient care, like obviously we need supervision like overnight, just because like I had a patient that was like a post-op spay. It was a Great Dane and it was routine, everything went fine. She was staying overnight just because it was later in the day that she got out of surgery, and she ended up having like a hemo abdomen in the middle of the night. So I feel like no matter what, like even if it is just like overnight, just like for monitoring like post-op, like minimal care, because this dog wasn't even on fluids or anything, there should be some level of supervision, even if like a nurse or a doctor or even like an assistant I would take
but what
just coming in checking on them.
So but if that patient was sent home post-op, right? So if
Yeah.
it's like sending home versus having them stay overnight unsupervised, like do you think that anything would have gone differently? You know what I mean? Like, I don't think the owners would have.
I don't think the owners would have like been able to tell, just because like the only reason I was able to tell was because like her heart rate was like consistently up and everything. And I was like, let me just check up blood pressure. Blood pressure was elevated and everything. I asked the doctor to scan them, just to see if like we could see any free fluid. And no matter what,
She's already at the hospital.
Yeah, like, well, any abdominal surgery, you're going to have some amount of free fluid present after a surgery, just because that's what happens. But there was like a larger pocket than that was expected, and we sampled it, and it was a hemo abdomen. We ran like a PCV on it, and it matched and everything. But it like resolved on its own over time. It's not like we did anything about it. But I feel like, I feel like the outcome probably would have been the same, but I don't know. I'm just really paranoid. I feel like
But if you're going
I would have
to
been like,
take on the
what if it
responsibility,
wasn't?
Yeah. And if like you're going to take on the responsibility housing a patient overnight, then you should have somebody actually.
Yeah, then it should be like good care and you should supervise, because like no matter what like the owner's paying for it, I feel like, well, if you're paying for it to be hospitalized overnight, it should have some level of supervision.
Yeah.
I wouldn't want my pet left in a hospital by himself overnight.
That is a thing though. Like when we rarely did that, we informed them like no one will be here.
Yeah.
Blah blah blah. You know, here are the risks, just so you know.
Yeah, I think it really is risk versus benefit.
Yeah.
I never worked in GP, so
yeah.
I've went straight into emergency and critical care at one hospital, so that's what I'm used to. So my opinion would probably be different, like if I worked at somewhere else and everything.